Good morning, everyone. So my name is Andre Jerome. I'm Executive Vice President of Global Business Development for Aurora Cannabis. And I'd first like to thank the organizers of this conference and the MCIA for extending this invitation. It's a real honor to be here this morning. I've got two pieces of bad news for you, though, starting. The first one is not only do I not have a Australian English accent, but I have a French-Canadian accent. So it's going to be that much more important for you to pay attention to understand what the hell I'm talking about. So apologies for making you work so hard so early in the morning. The second bad news is that I'm significantly impaired currently under cold medication, but no worries, I can still drive. And so if there's anything that I say that you fundamentally disagree or fail to keep you engaged, it's probably the medication speaking. But this being said, Aurora is proud, we've discussed yesterday, to make a modest contribution to the Drive Change campaign. I think it's really, really important for the future of this industry, and those current rules won't make any sense at all. The other thing I wanted to mention is my views are my views alone. Do not engage my employers or our partners for reasons that you will see a little bit later. There's a lot of content in the slides that I'm going to be presenting today. I'm not going to go into much detail. I've already taken half of my time, it seems, just making the introductions. But I am informed that the presentation is going to be available on the app. So for those who want to go into a little bit more detail, and if you have any questions today or later, that's going to be my pleasure to answer. So I thought I would spend a few minutes this morning. Aurora has been involved in a number of countries. We've entered countries, we've exited countries over the last several years. And there's a few things that we've learned. There's a few things that we've picked up here and there in different jurisdictions in terms of trends and so on and so forth. So hopefully some of these are going to be relevant to you if you do have global aspirations as well, or even if you are happy to continue to work and develop the Australian medical cannabis market. Some of these learnings are going to be relevant to you here as well. But first, a few words from my sponsor, Aurora. So who is Aurora? It's a Canadian company. Where else? I'm going to try to remain humble. I think we are one of the largest global medical company in the world. We have a number of state-of-the-art facilities in a number of countries. Most of them are EU GMP certified. In some cases, they're also IMC GAP certified. We participate in medical and in some cases recreational cannabis markets in different ways, depending on the jurisdiction, depending on the geography. So in some cases, we are wholly owned subsidiaries. Other cases, we are looking at joint ventures. And in other cases, like in Australia, we partner with our exclusive partners, MedReleaf Australia, which in my opinion is the best medical cannabis company in Australia, but I may be biased. Aurora's purpose is to open the world up to cannabis for patients primarily. We are primarily a medical cannabis company. We do participate in some of the recreational markets as well. We're empowered by people and enabled by science. We have a very, very strong scientific background and efforts. We have a dedicated state-of-the-art research facility in Comox on Vancouver Island. If you have the chance to go and visit, it's a beautiful part of the country, and it's an interesting venture as well. So last year, for example, we've hunted about 10,000 different phenotypes, which resulted in about 40 or 50 commercially viable cultivars. Our science and breeding and genetics is looking at a number of things in terms of potency, in terms of yields, in terms of plant structure, et cetera, but also doing a lot of research in terms of disease resistance, seed propagation, auto-flowering, and things like that. And I'm happy to report that we've just launched our first commercially available cultivar that is resistant to powdery mildew. So we have isolated the genes for resistance to powdery mildew. So you see in the middle of the picture, basically a little plant that's in the sea of white, but that plant remains green. That specific cultivar is called Valor. This is a cultivar that we've launched specifically for the veterans community in Canada. I think it's really apt and appropriate that it's a fighter. So this being said, let's go into kind of some of the lessons. Some of them are a little bit less controversial. Some of them may be a little bit more. The first, I don't think is controversial, and it's a question of time. Right? So everywhere that we're talking about, the genie's out of the bottle. So we will see medical cannabis regimes appear all over the world. And this is what we're witnessing now. But it takes time, and it always takes more time than people are counting on. If you forecast that a country is going to open up its medical cannabis regime in the next year or two, double that, and then double that again, and you're closer to probably the truth. Yeah? We see that in the States. So many people have made so much investments and invested hundreds and hundreds of millions of dollars, hoping that the next government, hoping that when the Democrat, hoping that and it takes. We see that in Mexico. They've postponed the launch of their medical cannabis regimes, year after year after year for at least 3 or 4 years. We see that in Thailand. We see that, I think the champions are the Netherlands. They've had some form of recreational cannabis framework for the last 50 years, but they're still, not quite there in terms of implementing a full regime. The implication of that, of course, is that if you do have global aspirations, or even in Australia, some people are looking at the recreational market potentially, it takes time. And even when you have the regulation, you have the political will and public policy makers making the rules, it takes, again, more time, because you have a pent-up demand in terms of patients and prescribers that are already there, but then to build that base, to build that critical mass, takes a lot of time. So we have Aurora entered into countries and stayed there for 2 or 3 years, helping to try to develop the framework, and then exited. And then it's been 3 years, and there's still no regime, there's still no product registered in some of those jurisdictions. So if build a long runway, make sure they have enough funding to last and outlast everyone else. The second learning for us is it's always kind of the same pattern, right? So if you are going to implement a new medical cannabis regime, chances are it's going to be very risk averse to begin with. They're often the product of political compromises. Before a country legalizes cannabis, you see all of these activists saying the sky is going to fall. We're going to see people high in the streets and doing all kinds of things. We're going to see the number of young people going in the hospital jump tenfold. We're going to see car accidents everywhere. And so there's opposition party. There's all of these groups that are so the ultimate, the first attempt to it is usually very restrictive. And may not be very conducive to promoting some of the objectives, the public policy objectives, in terms of providing easier access to that medicine. So count on this. Try to make sure that when those regimes are put into place, there's a periodical review, a mandatory review that's built into the enacting legislation, so that you can show 2, 3, 4 years down the road that the sky has not fallen, everything's fine. No one is doing all kinds of crazy things in the street. And some of the early movies from the 1920s about reefer madness and stuff like that are not really true. In Canada, for example, now we're proceeding to our 5-year mandatory review. Germany is doing the same thing with regards to the introduction of their recreational market. They're also reviewing some of the rules for medical. I had the discussion a couple of years ago, I think, when Brazil announced their medical cannabis market. I had the pleasure to chat with the president of the regulator then. And Brazil is predominantly a CBD regime. So THC is really hard to register, really hard to prescribe, because of course they were a little bit concerned about that. The ironic thing in the case of Brazil is that the president that conducted this introduction of this bill is was from the right at the time. It's been changed since, but is a former military man. And if you're talking about military and veterans, the type of cannabis medicine that they need most often is THC based, not CBD. So Canada has made all of the mistakes when it comes to cannabis. And if for those of you who are kind of following the market, it's been a bloodbath for the last couple of years. There's been so much value destruction. My company alone, we've probably written off about $5 billion of investment in the last couple of years. And some of that is kind of self-inflicted, but other than that is kind of the regulatory rules and some of the constraints that we've had to deal with. One of the things that I think Canada did well is that it did not try to force fit medical cannabis into an existing category. I come from, I'm a recovering lawyer. I worked all of my career in telecom. The last 10 years or so, I was looking at global public policy and regulatory for Vodafone Group in the emerging markets in Asia and Africa, et cetera, et cetera. So I don't come from a pharma background. And I think if you're a hammer, you see everything as a nail. And medical cannabis is not a nail. It's not exactly a nail. So if you try to impose pharma-style regulation on it, all you're doing is delaying providing fair, affordable, and broad access to that medicine to a number of people. Conversely, it's more than a natural remedy, so it has to be regulated because there's psychoactive elements to THC, for example, so there's some elements of safety that needs to be done. But Canada has been good in the sense that it created kind of a hybrid regime. And if you're looking at penetration rate in most of the countries that have legalized medical cannabis, of course there's a question of time, but you will see still that in places like Germany, 1/10 of 1% of the population is a medical cannabis patient. In other jurisdictions, in some of the US states, it goes up to 10% of the population being there. So what's the difference? Are we really arguing that patients, vary, or the proportion of patients varying, depending on the countries? No. The difference between 1 to 100 times more is really rooted in regulation. So encourage to try to look at it and regulate it, and the safety of patients is primordial, but we need to make sure that we don't stifle the access that can be provided. This is more controversial. Everyone likes to be special. Well, you're not. Sorry to say. So of course there's exceptions, and I'm just generalizing or overgeneralizing a little bit. But all patients are pretty much the same, and most of the differences that you will see between jurisdiction can be directly explained by either a difference in the time, the evolution. So we see cannabis market evolve over time, and you will see that not all countries, not all jurisdictions are at the same stage. Or explained by differences in regulation, not in differences in patient expectations and demand. Right? So in Canada, there's a race for potency. In Israel, there is no race for potency. Well, not officially, because the regulation caps at 24.4% maximum THC. So in Israel, there's a race to the larger bud size, right? But these are artificial, they're constrained by regulation. Overall, again, if you have global aspirations, that may be useful, but if you're also just very content in staying and developing the Australian market, you can look in the past at some of the more advanced jurisdictions or that had more experience, and that's going to tell you in broad lines what your future may look like. California is a year ahead of Colorado. Colorado is a year ahead of Canada. Canada is a couple of years ahead of Germany, and so on and so forth. And you see those developments happen markets after markets. Medical cannabis is not a proxy for rec. And this is important, and this is important for me because, as I mentioned, I'm a recovering lawyer. And I used to think, before I got involved in the medical cannabis industry, that it was a sham. It was a complete sham. It was just a pretense for potheads and you know, to use their drug of choice legally. Oh, my back hurts, you know, and so on and so forth. So a lot of people in Canada thought that this was the case because the Canadian government was forced to implement a medical cannabis regime by the Supreme Court, you know, through patient advocacy and so on and so forth initially. So the right-wing government, you know, was also of that opinion. So everyone, or a lot of people thought that when recreational cannabis was legalized in Canada, you would see the disappearance of the medical market. Guess what? It's been 5 years and it still hasn't disappeared. It's still growing slowly, but surely. And the only impediment is the way, if the regulation is designed in a way that provides incentive for patients to go and self-medicate in the rec market or vice versa. Again, it's artificial, it's regulatory driven, it's not market driven. Most people that are using medical cannabis, they want to do that under the supervision of a physician. They don't want to go into, you know, the little retail store and try to, you know, first of all, you're not going to find a lot of CBD in the rec stores, but they also want someone that's going to talk to them about their condition and titration and dosage, etc. Similarly, 40% in Quebec, a study just came out a few weeks ago, 40% of the people buying in the rec market from rec stores are self-medicating. So there's a continuum, I guess, of users. Some of them are purely medical, some of them are purely recreational, but there's a large portion in between that are, you know, using the product for both reasons. So it's not because you're talking about a potential development of a rec market that you know, the medical market should disappear. Quite the opposite. It should not. Germany, the German government, we've been in discussions with them quite extensively. This was the first question that they had: is do they need to maintain a separate medical regime? The answer is absolutely. So that brings us to, and again, you know, lots of slides, lots of material, but some kind of a high-level recommendations in terms of what we believe, you know, a good framework, what it requires. And the first one is, you know, that's interesting, is the attitude towards cannabis consumption are moderating across political line. It used to be in most jurisdictions that the liberal governments were in favor of legalizing, and the more conservative right-wing government were completely against it because of, you know, more conservative approach. You don't see that anymore. It's quite the opposite, actually. You see it's more libertarian approach to it, where the conservative, the right-wing conservative will say it's not up to the government to regulate these things. So that's an important lesson to look at when engaging with government, and you will maybe find some support in places where you would not have found support, you know, 10 years ago. Second one is, you know, a commitment to the need for high-quality production. I'm going to say something that's a broad generalization, right? This is not a new industry. This industry has been there for decades and decades and decades. It just was not very apparent, right? It was not regulated. It was not safe. It was not tested. It was not taxed. But that industry is still there, still exists, right? And the only thing that regulators are doing, for the most part, in jurisdiction where they have a legalized, you know, cannabis regime, is setting up where the line is going to be between who's going to be served by the legal market with safe, reliable, tested product, and who are going to continue to go to the black market, right? So it's not a new thing that's coming out. It's a thing that we're displacing from the illicit market, and that was one, in most jurisdictions, that was one of the main public policy objectives, was to try to get rid of the illicit market. In order to, you know, ensure, you know, greater safety, in order to bring that. So every time that the state or, you know, the regulator is trying to interfere in between the patient and his physician and the choices that they're making, they're just encouraging people, to go to the black market. Every time you're imposing taxes to a level where it becomes, punishing, you're encouraging people to go to the black market. Last week, there's been a debate for the last couple of months in Canada. There is a distinction in the Act between an edible and a concentrate. And the rules applying to edibles and concentrate in Canada are different. If you are an edible, you can only have a maximum of 10 milligram of THC per packaging. If you're a concentrate, it can go up to 100. So a lot of the producers, they've developed some products which look like an edible, but believe that they fit under the definition of a concentrate in order to provide something that patients want. They want to be able to have a bag with more than 10 milligrams and not have to buy 20 different packaging in order to get their medicine for the week. And finally, the regulator came out and says, no, we believe that the distinction between edibles and concentrate is important for public safety, so all of these products are now discontinued. The black market offers 1,000 milligrams per packaging. So what the regulator did, not willingly of course, is they gave a formalized monopoly to the black market to be able to sell those products to people without any testing, without any safety, without any taxation. So be really careful that the remedy that you're trying to implement is not worse than the problem you're trying to solve. More effective dialogue between producers and consumers. Hypersensitivity about illicit market and underage consumption. So technically the government should focus on these two things, right? We know that underage consumption may present some risks that are not as present for adult usage, and the government needs to do more in these things. Also needs to be able to control the illicit market, but it doesn't. It doesn't do any of these things. 5 years after complete legalization in Canada, because the medical market has been legalized for 22 years, the rec market for almost 5 years, there's still 50% of the market that's controlled by organized crime. 50%, that's not insignificant. And it's very easy. They've got great websites with great brands, great packaging, incredible product format and they deliver to your house within 24 hours with Canada Post. And there's absolutely no policing. There's no law enforcement agencies that are interested in or have the resource to do that. So you can't, you've tried prohibition for 90 years. It didn't work. It's not going to work going forward. So make sure that your regulation don't provide the incentives to people to continue to go there. Specific tailored medical channel with unique patient coverage and product. We've talked a little bit about that. This is not a proxy for rec. I've heard, I think yesterday, someone talk about individualized medicine. It's very much the case. Anyone here have heard of Charlotte Figge, Charlotte's Web? So this is what got me into the industry to begin with. I have a small daughter called Charlotte. As I said, I didn't believe that medical cannabis was real, and then did a bit of research and realized I've been lied to by my government. I've been lied by my teachers in high school and so on and so forth. So we're in this industry where we want to try to get financial viability, but we're in the industry because we're trying to help. So Aurora did the same thing about 3 or 4 years ago. There was a small boy in the UK and Ireland called Billy, and Billy got his CBD confiscated. He used to go with his parents to the Netherlands, I think, got his CBD drugs, oils, and got confiscated by the customs officials. So we flew Billy to Canada. We set it up in an apartment for 3 months. We developed a specific medicine for him. And then we hired the best lobby firm that we could in the UK and changed the law for Billy. Now, it's an exception. It should not be an exception. And we've been providing Billy his own individual. We have 1 patient on that formulation, and that's Billy. So don't interfere between the physician and the patient. They know best. And finally, yeah, the partnership between producers, regulators, et cetera. We have now more and more evidence, for example, about opioid reductions with the use of cannabis. We have some scientific evidence, we have some market evidence. Our veterans are saying to the Canadian government came up about 6 months ago and says, oh, we're spending $200 million a year in covering medical cannabis for veterans. And of course, they're not going to pull it out because it would be politically untenable to remove a benefit from the people that fought for the country. But then someone asked the question, says, well, what's the opioid price? It went from 500 million to 150 million for those people that are using that. So that's something that needs to be better understood. And so when we write a book, it's probably going to be the adventures of a traveling cannabis executive around different markets. It's been a fascinating ride, continues to be, and I think I'm already 5 minutes over my time, so apologies for that. Thank you very much for your attention.
Thanks, John and Andre. That was great. We do have some time, and we will get as many questions in as we can. There's some roving mics around, so please put your hands up. We have a question here, but I think I'm going to kick one off because we're talking around illicit market. And John, in relation to the report, what sort of numbers in Australia are we looking at for illicit use?
Thanks. I personally don't believe the data in relation to drugs. I did see that the Australian Criminal Intelligence Commission's just come out with some more wastewater analysis yesterday. It's pretty accurate for other drugs, I think not so much cannabis. And the biggest problem is the self-report in a government-administered survey of a criminal activity. So, I've actually asked a woman who was on methadone and whose brother was methamphetamine dependent and was part of the Australian Institute of Health and Welfare survey, which shows, lifetime use about 40%. But I asked her how many people she thought in her community, which was Maui, how many people in that community that consume illicit drugs would honestly answer the government questions, and she thought about 5%. So, I don't know.
So it's almost like a multiple of that, really. We're looking at scratching the surface when we look at those reports. And when you look at, you said $1.7 billion to law enforcement. That's pretty significant when that can be spent budget-wise healthcare. So have you just uncovered the subsidising of medical cannabis?
I think the problem is that, there's a lot of challenges for police, and there's a lot of serious crime that police are not getting to. So to my mind, the saving in law enforcement in relation to cannabis would be best off spent on other crimes, particularly, family violence is a big issue in the community, and so is white-collar crime. Focusing on those issues, I think, would be a good spend of that money. Focusing on cannabis is a waste.
It's fair to say. Have we got any questions out in the audience? Just looking for those hands to be popped up. But probably one for Andre now in relation to what can industry and policymakers do to work together?
Well, I think it's a feedback loop that's important, right? So I don't believe that policymakers intend to make wrong decisions as a matter of fact, right? So everyone is trying to do the right thing. And I said earlier that it's not a new industry, it's an industry that's been, but in some aspects it is new. The legal aspect is relatively new, and you're not going to, dial in everything right from the start. So I think it's that constant feedback loop and policymakers being willing and engaging with the industry to say, okay, what's working, what's not working, and let's see where things are at. Let's monitor. Let's take a factual-based approach to this. not only, advocacy groups, one side or the other side of the spectrum, and just looking at the data and adjusting the framework. The goal, of course, is, you want to try to remove any of the market failures in terms of safety, et cetera, but you also don't want to create too much distortions. In a lot of countries, including Canada, especially for the rec market, you've created a lot of artificial distortions by creating massive supply issues that are contributing to a lot of the issues the industry is facing right now.
Has anyone got it right yet?
I think, it's difficult to say a specific country. Depending on the public policy objectives that they're pursuing, it's a little bit different. I think Australia is in a very good place. Of course, there's things around, driving issues and so on and so forth, but you see the pickup in terms of the percentage of the population. So there doesn't seem to be too many impediments to providing access. The price is still a little bit high for a lot of people, especially in a context where there's no coverage. But I would say most jurisdictions are doing really, really good things, and also some mistakes. Australia is in a good place, I think.
And there's a question on it is one for yourself there, Andre, around where do you see the clinicians fitting in relation to today?
So clinicians in terms of, doctors and
general practitioners.
So listen, I don't have any problems with a recreational cannabis regime. I'm not in this industry for that. So to me, it is first and foremost a medical product. During the pandemic, we had a hard time trying to get our employees to go into the facilities and work every day, with the uncertainty. And one of the things that we did is we took the testimony of a few of our veterans patients, which produced videos, for the benefit of our employees, and those videos were heart-wrenching. So people saying thank you for going in the facility day in and day out. Without you, I would not be here anymore. I'm not I wouldn't be the father that I am. I wouldn't be the son that I am, or the husband that I am. So that clinic, aspect of it is really, really important. Traditionally, the medical association, again, I think Australia is one of the exceptions. The medical association have taken a very conservative approach. Where there's not enough evidence. Again, trying to force fit this into a more traditional pharma. But we see a lot of doctors in most of the countries that have kind of saying, well, I know what my medical association is saying, but I also know what my patients are saying and see the evidence. And no, we don't have all of the answers, but you know what? The risks are very limited. There's 2,000 people dying from an overdose of aspirins in the U.S. Every year. We don't see that with medical cannabis. It is not a risk-free product, so doctors need to be involved. But no, the role of doctors is more important than ever, I think.
One more question, then I'll throw one to John. In relation to, in terms of driving the legalising of cannabis, there was Hunter Land mentioned yesterday around the quality, or it might be stifled due to there being a lack of research in the plant-based, but obviously your presentation then showed some pretty interesting research in relation to plant science. Would you agree with that?
So, no, I'm not sure the Canadian rec industry has stifled research or has had an impact in terms of product quality. The standards for production of rec cannabis versus medical cannabis are the same, right? So up until it becomes packaged, you don't know where the flower is going to be, if it's going to go to the medical patient or to the rec. Now, within the rec, there is a wider range of segments. Same thing as craft beer or the beer market, right? So you have 10% of the market where there's connoisseurs that are going to be willing to pay a little bit more for a very premium product, well crafted, etc. But then you've got a bunch of people on the rec market that are saying, I want the best quality for the money. I want the best value, and so you will see a wider range of quality product. And when I say quality, of course, I mean it in the qualitative sense of smell and potency. I'm not talking about safety. Safety is the same standards for all.
And John, one for yourself, in relation to your report, when they get published, was there anything that stood out that, as a surprise, that you weren't?
Oh, that's a curly one. It took so long to actually finalise the report because we were so meticulous about it. I think any early surprises were eclipsed by a sort of normalisation. But I think the biggest surprise for me was just doing the basic maths of how many arrests per year and then adding it up over 10 years of government reports in terms of arrests. So that 700,000 number, I'm still amazed that that's the level of interface that the Australian community's had with law enforcement in relation to cannabis in the last 10 years. That's a huge number of people who are basically underground in relation to their drug use, often having to access it from the criminal, typically from the criminal underworld, but more importantly, not in healthcare and not being managed by medicos. I think, if a frontier of medicinal cannabis for Australian practice was identified to me during the consultations, it would be the use of prescribing cannabis for substance use disorders, so that there is people able to transition from illicit use to medically managed use and actually deal with their dependence issues. I think there's not enough people that see medicinal cannabis as an opportunity for substance use disorder, and ultimately I think it's so much safer from a system level or a public health perspective. It would be better off if people were accessing medicinal cannabis in order to avoid the criminal underworld.
I don't think I could say it better in terms of, that's a lot of arrests, and they probably need to be, like you said, focused elsewhere on harder criminal activity that are wasting our taxpayers' dollars. And that is going to wrap up our session. We are 5 minutes over. It is morning tea time. I'd like you to put your hands together for Andre Jerome, John Ryan, who joined us.